The 3 best foods for lowering high blood pressure in seniors. Protect your heart today. Have you ever woken up in the middle of the night feeling that throbbing pain in your temples? Or perhaps you were shocked to see the numbers on your blood pressure monitor rising higher and higher, while your doctor shakes his head with concern. I know exactly what it's like to live with that constant fear, checking your pressure multiple times a day, carrying medication everywhere, and avoiding joyful moments with family for fear that emotions might overwork your heart. Hypertension steals more than just our health. It steals our peace, our freedom. And the worst part is hearing those same generic recommendations. Cut the salt, lose weight, take your medications, as if it were that simple, right? After years of helping people like you regain control over their blood pressure, I've discovered solutions that your doctors rarely mention. Natural, accessible, and truly effective solutions. In today's video, I'm going to share with you the 3 most powerful foods specifically for seniors who want to control high blood pressure naturally, foods that have transformed the lives of hundreds of my patients. Imagine being able to gather with your grandchildren without worry, travel without the fear of an emergency away from home, or simply wake up without that heavy feeling in your chest. This is not just another empty promise. It's a proven path that you can start today, with simple foods and habits that are already within your reach. So stay with me until the end, because this could be the most important video you watch this year for your cardiovascular health. Before we begin, I'd love to know if you or anyone in your family suffers from high blood pressure. Leave a comment below sharing your experience or any questions you may have about the topic. And don't forget to subscribe to the channel and turn on notifications to receive more content that can transform your health. Let's first understand why high blood pressure is so common in people over 60. As we age, our blood vessels tend to lose elasticity, becoming stiffer and less able to adapt to different situations throughout the day. It's like a new rubber band that after much use no longer returns to its original size with the same ease. This natural stiffness means the heart has to work harder to pump blood throughout the body, resulting in higher blood pressure. Additionally, the kidneys, which are crucial in regulating blood pressure, may also lose some of their efficiency with age, retaining more fluid and sodium than they should. And if we add to that years of not-so-healthy eating habits, accumulated stress throughout life, and even genetic factors, we have the perfect recipe for hypertension. But here's the good news. Contrary to what many believe, old age doesn't mean you're doomed to live with high blood pressure for the rest of your life. With the right food choices, we can not only control hypertension, but in many cases, even reverse part of it, allowing for a significant reduction in medication. Under medical supervision, of course. The first powerful food I want to introduce you to is beetroot. But we're not just talking about adding a few slices to a salad occasionally. Beetroot contains compounds called nitrates, which, when consumed, are converted by our bodies into nitric oxide, a substance that directly acts on the walls of our blood vessels, promoting their relaxation and dilation. It's like we're naturally unclogging the pathways through which blood flows, making it easier for blood to flow and consequently reducing pressure. A study published in the Journal of Nutrition showed that consuming beetroot juice daily for just 2 weeks was able to lower systolic blood pressure by up to 8 points in elderly people with hypertension. To give you an idea of the impact of this, a 5-point reduction in systolic pressure is associated with approximately a 14% decrease in the risk of stroke and a 9% reduction in the risk of coronary diseases. Impressive numbers, don't you think? But how can we incorporate beetroot into our diet effectively? The ideal is to consume about 200 milliliters of beetroot juice per day, preferably in the morning on an empty stomach. If the strong flavor of pure beetroot doesn't appeal to your taste, you can combine it with apple, carrot, or orange to soften the taste. Just be careful with the amount of fruit you add to avoid raising the glycemic index too much, especially if you also deal with diabetes. Another option is to bake the beetroot whole with its skin, wrapped in aluminum foil for about 40 minutes at 180 degrees Celsius. After it's baked, it becomes sweet with a soft texture, making it an excellent accompaniment for main meals. If you have kidney problems or a history of oxalate stones, it's important to consult your doctor before significantly increasing beetroot consumption, as it is rich in oxalates. And don't be alarmed if you notice reddish-colored urine or stool after consuming beetroot. This is completely normal and simply indicates the presence of a natural pigment called beta-cyanin. The power of beetroot can be further amplified when combined with foods rich in vitamin C, such as lemon or orange. This is because vitamin C enhances the conversion of nitrates into nitric oxide. A practical tip is to add a few drops of lemon juice to your beetroot juice right before drinking, or even finish off your baked beetroot with a little citrus juice. The blood pressure lowering effect of beetroot usually begins to be noticed about 3 hours after consumption and can last up to 24 hours, making a daily morning consumption a smart strategy for keeping blood pressure more stable throughout the day. Let me pause for a moment and ask something important. When was the last time someone really listened to your concerns about high blood pressure? Not just the numbers from your test, but how you truly feel living with this condition day after day. Many people privately tell me how isolated they feel, as though no one really understands the constant burden they carry, the silent fear that accompanies every beat of their heart. If you identify with this, I'd love to hear your experience in the comments below. It could be something as simple as, "I've struggled with hypertension for X years, and what worries me most is..." Sharing your story not only helps me create more relevant content for you, but also shows others watching that they are not alone in this fight. Sometimes, knowing that someone else is going through the same thing brings immense relief. And who knows, your experience might be exactly what someone else needs to read today to find hope. Now, let's continue our discussion on how we can transform this reality together. The second food that is proven to be a true ally against hypertension, especially for people over 60, is avocado. Rich in potassium, magnesium, and monounsaturated fats, avocado works in various ways to promote cardiovascular health. Let's take a closer look at how this happens. The potassium in avocado works in balance with sodium in our body. While excess sodium retends fluid and raises pressure, potassium helps the body eliminate excess sodium through the kidneys, acting as a natural diuretic. A medium avocado contains about 975 milligrams of potassium, which is approximately 20% of the recommended daily intake for an adult. This is a significant amount in a single food. Magnesium, another abundant mineral in avocado, is essential for proper muscle function, including the heart muscle. It promotes the relaxation of arteries, contributing to better blood circulation. Studies show that many seniors have insufficient magnesium levels, which can contribute to higher blood pressure. Regularly consuming foods rich in this mineral, like avocado, can be a natural way to complement these levels and improve the body's response to stress, another factor we know contributes to blood pressure spikes.
But perhaps the most surprising component of avocado is its monounsaturated fats, similar to those found in olive oil. These healthy fats help reduce LDL cholesterol, the bad cholesterol, and increase HDL, the good cholesterol. Additionally, these healthy fats help modulate inflammation in the blood vessel walls, a factor often overlooked when discussing hypertension. Chronic low-grade inflammation, common in seniors, makes the arterial walls stiffer and less responsive. The fats in avocado have an anti-inflammatory effect that, over time, can help restore some of the vascular elasticity. How can we incorporate avocado into our daily diet? The ideal is to consume half an avocado per day, which can be added to salads, used as a butter substitute on bread, or even blended with plant-based milk for a creamy smoothie. For those concerned about calories, remember that the calories in avocado are primarily from healthy fats that promote satiety, helping with long-term weight control. A tip for preserving the other half of the avocado without it turning brown is to leave the pit in and drizzle it with a bit of lemon juice before storing it in the fridge. A particularly powerful combination is consuming avocado with dark leafy greens, such as arugula, spinach, or kale. These vegetables are rich in nitrates, just like beetroot, and the fat in avocado aids in the absorption of various fat-soluble nutrients present in these greens. A study conducted by the University of California showed that this combination can enhance the beneficial effects of both avocado and greens on cardiovascular health. Another important issue about avocado is its ripening rate. Many people buy avocados that are already ripe and end up wasting part of it because they don't consume it in time. An interesting strategy is to buy avocados that are still firm and let them ripen gradually at home. To speed up ripening, place them in a paper bag with a banana or apple. To slow it down, keep them in the fridge once they reach the desired ripeness. This way, you can plan their consumption throughout the week. Some people ask me if the processed version of avocado, such as store-bought guacamole, has the same benefits. The answer is that while it still contains many of the original nutrients, it's best to make your own guacamole at home, avoiding excess salt and preservatives often added in industrial versions. A simple homemade guacamole can be made by mashing the avocado with a bit of onion, tomato, cilantro, and a squeeze of lime without adding any salt.
An important warning: if you are taking medications to increase potassium levels or have kidney disease, consult your doctor before significantly increasing your avocado consumption, as this combination could elevate potassium levels in your blood too much. The third food I want to share with you, which has surprising power in lowering blood pressure, especially in seniors, is natural yogurt. And I'm specifically talking about yogurt without added sugars and preferably full fat. Several studies have shown a strong link between regular consumption of fermented dairy products, such as yogurt, and lower blood pressure. But why does yogurt have this beneficial effect? The answer lies in the unique combination of nutrients and bioactive compounds. First, yogurt is an excellent source of bioavailable calcium, which means it's easily absorbed by the body. Calcium plays a direct role in regulating blood pressure by helping the relaxation and contraction of blood vessels. A study published in the American Journal of Clinical Nutrition showed that people who consumed at least 2 cups of yogurt per week had a 20% lower risk of developing hypertension compared to those who rarely consumed it. In seniors, this protective effect can be even more significant since calcium absorption tends to decrease with age. In addition to calcium, yogurt contains bioactive peptides, which are small chains of proteins formed during the fermentation process. These peptides act similarly to ACE inhibitors, the famous antihypertensive medications known as ACE inhibitors. They inhibit the enzyme that causes blood vessels to narrow, allowing them to stay more relaxed and thus lower blood pressure. Another important component of yogurt is the probiotic bacteria. These beneficial bacteria help maintain a balance in the intestinal microbiota, which may seem unrelated to blood pressure at first. However, recent research has demonstrated a surprising connection between gut health and cardiovascular health, known as the gut-heart axis. An imbalance in the gut microbiota can lead to increased systemic inflammation, which in turn contributes to arterial stiffness and hypertension. The bacteria present in yogurt, mainly Lactobacillus and Bifidobacterium, produce compounds that help reduce this inflammation and improve endothelial function, the layer that lines our blood vessels.
How can you incorporate natural yogurt into your daily diet to get these benefits? Ideally, consume at least 150 grams of natural yogurt per day, preferably in the morning or as a mid-afternoon snack. An important tip is to choose yogurts that specify they contain live and active cultures. You can enrich yogurt with seeds like chia or flax, which, in addition to adding fiber, are sources of omega-3 fatty acids, another nutrient with anti-inflammatory properties and benefits for the cardiovascular system. For those who are not used to the more acidic taste of natural yogurt, one option is to lightly sweeten it with a small amount of honey, especially Manuka honey, which has additional anti-inflammatory properties, or with fresh fruits like banana, apple, or strawberry, which contribute fiber and antioxidants. However, avoid industrially sweetened yogurts, as they often contain high amounts of sugar, which can counteract some of the blood pressure benefits. A particularly powerful combination is mixing yogurt with cinnamon powder. Cinnamon has properties that help regulate blood sugar and also lower blood pressure. Just sprinkle half a teaspoon of cinnamon over the yogurt to enhance its effects. For those who are not used to the more acidic taste of natural yogurt, one option is to lightly sweeten it with a small amount of honey, especially Manuka honey, which has additional anti-inflammatory properties, or with fresh fruits like banana, apple, or strawberry, which contribute fiber and antioxidants. However, avoid industrially sweetened yogurts, as they often contain high amounts of sugar which can counteract some of the blood pressure benefits. A particularly powerful combination is mixing yogurt with cinnamon powder. Cinnamon has properties that help regulate blood sugar and also lower blood pressure. Just sprinkle half a teaspoon of cinnamon over the yogurt to enhance its effects. For those who are lactose intolerant, there are yogurts with low lactose content on the market, or even options made from fermented plant-based milk, such as coconut or almond yogurt, which also offer probiotic benefits, although their nutritional profile differs from traditional yogurts. Some people ask me if cheese would have the same benefits for blood pressure as yogurt. While cheese shares some nutrients with yogurt, such as calcium and proteins, it is usually higher in sodium and undergoes a different fermentation process. Therefore, while it can be part of a healthy diet, yogurt remains the superior choice when the goal is to lower blood pressure. An important warning for those taking certain antibiotics. Some of these medications may interact with the probiotics present in yogurt, reducing both the effectiveness of the medication and the benefits of yogurt. In these cases, the best approach is to consume yogurt at least 2 hours before or after taking the antibiotic. To maximize probiotic benefits, yogurt should be consumed at room temperature or slightly chilled, not cold, as extreme cold can slow down the activity of the beneficial bacteria when they reach the gut. Now, imagine the power of these 3 foods when combined into a complete dietary strategy. Natural yogurt in the morning, perhaps with some cinnamon and seeds, a beetroot juice as a morning snack, and half an avocado included at lunch or an afternoon snack. This simple combination provides a complete spectrum of nutrients that work in synergy to lower blood pressure through multiple mechanisms: vascular relaxation, natural diuretic effect, reduction of inflammation, improved endothelial function, and gut microbiota balance. It's important to emphasize that these foods do not replace medications prescribed by your doctor. In fact, they work as a complement, enhancing the effects of medications and, in some cases, allowing for a gradual reduction of doses under medical supervision. Always communicate with your doctor about any dietary changes you're making, as it may be necessary to adjust your medication dosages as your blood pressure starts to stabilize naturally. One final point that often goes unnoticed when we talk about diet for blood pressure control in seniors is proper hydration. Even mild dehydration can thicken the blood, making circulation harder and overloading the heart. Therefore, in addition to including the foods I've mentioned, be sure to drink at least 1.5 to 2 liters of fluids daily, preferably water. A tip for those who struggle to drink plain water is to infuse it with cucumber slices, mint leaves, or lemon slices, which adds a mild flavor without calories or sodium. Another complementary strategy is regular consumption of teas that have vasodilating properties, like hibiscus tea. Several studies show that drinking hibiscus tea daily can reduce both systolic and diastolic pressure to levels comparable to some mild hypertension medications. Ideally, drink 2 to 3 cups per day without added sugar. You can prepare the tea with dried flowers or ready-made tea bags and consume it either hot or cold. In addition to foods that help lower blood pressure, it's equally important to be aware of foods that can raise it. Salt is the most well-known, but there are other hidden culprits in modern diets. Ultra-processed foods, even those that don't taste salty,
often contain high amounts of sodium as preservatives. Products like industrial bread, processed cheeses, deli meats, instant soups, and even artificial sweeteners have been linked to increased blood pressure. A practical tip is always to read food labels, looking for those with less than 140 milligrams of sodium per serving, considered low-sodium foods. A question I frequently get is, can I drink wine? I've heard it's good for the heart. Moderate consumption of red wine, especially during meals, has been associated in some studies with cardiovascular benefits due to the presence of resveratrol, a powerful antioxidant. However, for people with hypertension, especially seniors, alcohol should be consumed in very limited quantities, if at all. The recommended maximum would be a small glass, 150 milliliters, of red wine, no more than 3 times a week, always with meals. It's important to remember that alcohol can interact with several medications commonly prescribed to seniors, so consult your doctor on this specific issue.
Another common question concerns coffee. Contrary to popular belief, recent studies show that moderate coffee consumption does not chronically raise blood pressure in people who are already accustomed to caffeine. In fact, some components of coffee, such as polyphenols, may even have long-term cardiovascular health benefits. However, people sensitive to caffeine may experience temporary increases in pressure after consumption. The recommendation is to limit intake to no more than 2 small cups per day, preferably before mid-afternoon so it doesn't interfere with sleep, which is also crucial for controlling blood pressure. Speaking of sleep, this is an often overlooked aspect of hypertension control in seniors. Sleep deprivation or poor quality sleep is directly associated with higher levels of stress hormones like cortisol, which in turn raises blood pressure. Establishing a regular sleep routine in a dark, quiet, and comfortable environment can be just as important as food choices for keeping blood pressure at healthy levels. Regular physical activity also plays a crucial role in reducing blood pressure. Studies show that moderate intensity exercises, such as 30-minute walks 5 times a week, can reduce systolic pressure by 4 to 9 mmGh, a result comparable to some medications. For seniors, water exercises like water aerobics or swimming are excellent options as they engage the cardiovascular system without putting stress on the joints. The important thing is to find an enjoyable activity and stick with it consistently, always with prior medical approval. Stress management is another key pillar for controlling blood pressure. Techniques such as meditation, deep breathing, yoga, or Tai Chi have shown significant results in lowering pressure in various studies. Spending just 15 minutes a day practicing one of these techniques can make a big difference in the long run. A simple technique you can practice anywhere is the 4-7-8 breathing. Inhale through your nose, counting to 4, hold your breath, counting to 7, and exhale slowly through your mouth, counting to 8. Repeat this cycle 4 times, 2 to 3 times a day, to help calm the nervous system and reduce stress-related blood pressure spikes. Another aspect to consider is vitamin D supplementation, especially in seniors. Several studies have shown a correlation between low levels of vitamin D and hypertension. Given that the skin's ability to produce vitamin D decreases with age and that many seniors spend less time in the sun, supplementation may be necessary. However, this should only be done after checking blood levels and under medical supervision, as excessive vitamin D can also pose health risks. One point that requires special attention when talking about blood pressure control in seniors is regular home monitoring. Blood pressure naturally fluctuates throughout the day, and a single measurement at the doctor's office may not accurately reflect your usual state. The phenomenon known as white coat hypertension, where pressure rises only due to nerves during a medical appointment, is especially common in seniors. Therefore, the ideal is to keep a blood pressure diary with measurements taken at home at different times of the day, always in the same position and after a few minutes of rest.
These records are invaluable for your doctor to assess the effectiveness of both medications and lifestyle changes you're making. It's important to remember that reducing blood pressure doesn't happen overnight. It's a gradual process that requires consistency and patience. Some people may notice significant improvements in just 2 weeks, while others may take 3 months or more to see substantial changes. The important thing is not to give up and continue making good food and lifestyle choices even if results are not immediately noticeable. A final warning I would like to leave concerns supplements sold with miraculous promises of lowering blood pressure. While some supplements may indeed have benefits, many lack proven effectiveness and may interact with medications commonly prescribed to seniors. Garlic, coenzyme Q10, omega-3, and certain herbal extracts have some scientific backing, but should never be used as substitutes for prescribed medications without medical guidance. The safest and most effective approach is always to prioritize whole foods in their natural form, like the 3 I detailed today. If you've made it this far, you probably know what it's like to live with uncontrolled blood pressure, that constant worry, medications with side effects, and restrictions that seem to rob a little of the joy from daily life. I want you to know that you're not alone on this journey. Our channel was born from the desire to create a support community for people like you, who seek natural and effective alternatives to care for their cardiovascular health. Every week, we share new discoveries, simple recipes that help control blood pressure naturally, and answer questions that doctors often don't have time to explain during a consultation. If this content made sense to you, consider subscribing to the channel and turning on notifications. That way we can walk together on this journey of health, one step at a time, without hurry, but with the consistency that your heart deserves. I don't promise miracles, but I guarantee honest information based on solid research and the experience of those who've already achieved real results. Take good care of yourself, and I hope to see you in the next video where we'll continue our conversation on how to live better, even with hypertension. Your heart thanks you for every little bit of care you dedicate it today.